Hello everyone. In my office I see a lot of people who come in for headaches. Today I'm going to talk to you about Arnold's neuralgias, which are the third leading cause of headaches after migraines and tension headaches. Arnold's neuralgias cause very characteristic pain because they follow a specific path. So it starts from the top of the neck, goes to the back of the skull, and can even reach the eye. Sometimes the whole path hurts, or sometimes it's just a specific spot like a point here or a point there. The pain can sometimes be very sharp, like burning or electric shocks, or sometimes it's more dull and can last a long time. So either we have very acute attacks that hurt a lot, or we have something that can settle in for weeks, months, or even for some people years if they don't do anything to feel better. So what causes this kind of pain? It's a nerve that's pinched, which comes out of the neck and innervates that whole part of the skull. So since it's pinched, it causes pain along the entire path of the nerve, even though the problem actually comes from the base of the skull and the upper cervical area. This nerve is called the Arnold nerve. That's why we call it Arnold's neuralgia. So what can cause compression of this nerve? So it can be several things, more or less serious. So it can simply be a joint blockage. For example, the first or second cervical vertebra can get stuck, causing inflammation and compressing the nerve. So generally that's not very serious and it goes away quickly with osteopathy. We can have a herniated disc that compresses the nerve, so that's already a bit more troublesome, but we can still have a good effect with osteopathy. We can just have muscle tension in some small muscles here, suboccipital muscles. We can also have arthritis, different causes. There are several things that can cause Arnold's neuralgias. It can have traumatic origins, following a shock or an accident. It can be prolonged, repetitive postures, like when you're on the computer, or even worse, on your phone, where you bend your head like this, and it creates a lot of tension in the upper neck. It can also be stress, or clenching your jaw, because there's a more or less direct connection between the jaw and the neck. So very often people who have Arnold's neuralgia grind their teeth during the day, or clench their teeth at night. But it can also be issues with the mobility of the bones in the skull, and for that, I invite you to check out the video on cranial osteopathy. Arnold's neuralgias are very common in the population. However, when you have one, it's useful to see a doctor to make sure it's Arnold's neuralgia, and not something else like meningitis, an artery dissection, or facial neuralgia. So the doctor will be able to tell you what it is, and if necessary, do further tests with medical imaging to see what's going on. So if you have headaches, don't hesitate to see an osteopath. If you're around Montpellier, feel free to come to my office. I hope you enjoyed this video. If that's the case, feel free to like, share, subscribe and comment. It would always make me happy. See you soon.